Let me now introduce our keynote speaker, Toby Eccles, OBE, who needs no introduction, the founder of Social Finance UK. He actually led the early social impact bonds, including the famous Peterborough Prison example and various others, and championed the transition to development impact bonds. So I think you will have heard of Toby, and we look forward to his words of wisdom.
Okay, well, I better dream some up quick. Thank you for inviting me. I have to say I've been looking forward to today for a little while. It's, I think, probably the largest gathering of people who've been thinking about this set of problems that I've yet met. And so I'm really looking forward to the rest of the day and thinking about things. When thinking about how to start this off and kick off the conversation, I felt it was really important to begin with the why. Why are we doing this? Social finance started really 10 years ago because we observed that the way that finance worked in the social sector often didn't support organizations as much as one would like, that the accountability of finance in terms of its ability to drive impact was not as high as one would like. But the one people that you can never really give feedback to are the people who are doling out the cash. So we felt that there was an elephant in the room in so many conversations, and we really set up social finance to try to talk to that elephant, but still obviously existing in the same system of needing to get funded by the elephant. So you can see that's always been a slightly awkward situation. But the early days, we thought this was about investing in social organizations. And very quickly, we realized that we needed to connect their revenues more closely to their outcomes, to what they were looking to achieve. And the question that we were asked very early on is that essentially there are a lot of services people would like to see more of, which are typically preventative services, but there never seems to be the resources for them because the money is going on acute services. The traditional story on this one is that there's a cliff which people keep falling off, and then they get carried by ambulance off to the hospital. And someone says, can we build a fence? And the answer is no, because we're spending all the money on the ambulance. And so the question then became, the question we were asked very early by some of our board members was, actually, can you start to get preventative services paid for by the costs of the acute? And that's why we started thinking about a number of areas, but the key one was prisons. Well, that was the one that came through in the end. And short sentence offenders in the UK do have a fairly unusual set of statistics. I always thought that 63% of reconvictions within a year was quite bad, but finding out that they've had 7 previous incarcerations on average and have committed 43 previous offences on average really gave the sense that this was a revolving door through the system, and it was something that really wasn't working. So it was an area where we were focusing on where outcomes were really poor, and the government wanted to do something, but didn't know what the answer was. And that was the combination of things that we were looking for. And so we offered them something which they hadn't been offered before, which was simply, if we can measure the economic benefit to you of reduced reconvictions, and we can agree a way of measuring it, we are happy to take a contract where we only get paid for the difference we make. And that seemed to open up and enable a set of conversations that they weren't able to have before. And obviously, as you all know, but at the time was innovative, the trick, if you like, was that it wasn't that you were trying to find service providers that were willing to wait 2 or 3 years to get paid, because they don't exist. But we were finding a community of investors that were willing to take that risk in the meantime, that were willing to take that outcome risk and enable services to be delivered, and for us to focus in on whether that population, that short sentence offender group, can be helped to move onto a different path, hugely improving their lives and reducing costs to the state at the same time. And that was the question. So the starting piece around this was actually around, in many ways, government innovation and wanting to create preventative services. But when we move to international development and we start thinking about it, I'll now switch to what that context looks like, and then we'll look at what the why is in international development. Because if we don't keep that in our minds, then we'll just be people running around with a new hammer looking for a bunch of nails. And that's not really what we should be doing if we're trying to make social change happen. So clearly, impact bonds are not, I just wanted to make this clear, bonds. For anyone who's, I spent my first 2 or 3 years talking about impact bonds, and the first question was always that slightly awkward, but these don't look like bonds to me. And the poor person had spent the entire presentation looking at it, trying to make them into bonds. So I just wanted to start off very, very clearly in case that was still there. It's a results-based contract. And in international development, of course, with results-based finance and other models, this was actually something that was fitting into a much narrower niche than it was in the UK domestic context. But the critical difference when you compare it to results-based finance generally is that it comes with investment. And therefore, the risk-taking is real. And the risk transfer can be real. Because what we saw in a lot of risk-based, results-based models previously was that actually, yes, they were results-based, but you know what? We really do need to make sure we pay them. And so the risk got diluted until eventually it was results-based in order to keep everybody happy, but actually, people got paid. So adding this dimension of some investors did 2 things. It meant that the risk could be real, and it meant that the delivery agency needed to be accountable quickly if they're not going to be delivering outcomes. And that changes the dynamic in terms of how they work. Also, just again, for those of you who are, I'm aware I'm in a development specialist community somewhat here, so just to say there are lots and lots of very important types of intervention where this is totally and utterly irrelevant. Again, just in case there are people who go around with a social impact bond as a universal panacea, I'm not, you'll be pleased to hear, one of them. And so I just want to be very clear, this is really very much for programmatic funding and the difficulties of programmatic funding when obviously the circumstances on the ground are likely to change and they may not be what you thought they were in the first place. That combination. Where do you actually need to change what you're doing? And the case for these, if you like, is very straightforward, is that where do you need the ability to unlock innovation and really focus on rigor of measurement and adaptation? The models, if you like, the transition I think about on this is if you're building a bridge, then it's a really good idea to have a really good plan at the beginning, just in case any of you are planning to build a bridge in the next few months. Okay, architectural plans, good. Yeah, structural engineers, excellent. Because the ends that you put your bridge on are unlikely to move in the next few years. And therefore, that bridge plan is likely still to be right in 3 years' time when you start building it. The problem for most of development is that those ends move and they get a little closer together or a little further apart in between your planning stage and your implementation stage. And if you're too rigorously stuck to your original plan, then what we actually tend to do at the moment is because the process of changing that plan is too arduous and complicated, we build the bridge in thin air and people can't actually use it. And that's the problem that we've got at the moment. Or you build a bridge and it's great. It's fixed onto one end really well. It's just the other end's a little bit off. So you have to jump. So that one's okay as well. If you can jump, it's all right. But that's the sort of underlying structural problem that we're trying to deal with, the moving ends. And at that point, how do you adapt the program and how do you make sure that your contracting not only allows it, but positively enforces it? One of the pieces that I noticed when thinking about this was actually brought up by a colleague of mine. He said, if you imagine 2 separate scenarios. Scenario 1, you're starting up a startup in Silicon Valley, okay? And after 6 months, you go to your funders and you say, it's great. We're doing exactly the same as we were doing at the start of the project. Then it's quite likely they would look at you as if you were completely insane, okay? Because the whole point is meant to be learning and changing and adapting and improving. Now, if you come with a development project, and after 6 months, so we've learned a tremendous amount, and these are the things that we need to change, then there would be a rather awkward silence. What did we get wrong in the strategic planning? Do you realize I've got to tell all my bosses that I got it wrong? And that's got to go through 3 layers before we can make those changes. You better not want to do it again. And so therefore, with monitoring, notice how passive monitoring sounds, and evaluation, which happens a few years afterwards, we can safely shut our eyes to what are actually happening now and worry about that in the future. So that's, I suppose, I'm afraid I might get a little repetitive on that subject, but we'll go with it, okay? That's, to me, if you like, that is the movement that we're trying to create here. Forget the finance. The movement is to making adaptive, personalized, relevant services that work for poor people. Instead of bureaucratic, one-size-fits-all, take-it-or-leave-it services, which actually, in developed economies like Britain and the US and elsewhere, are getting a pretty strong backlash. And that's actually creating and ensuring public relevance of public services. One of the things I find frightening in the UK is if you go to a lot of poorer communities and you ask them about public services, they dismiss public services. They don't feel they're relevant to their particular needs. And that's a huge fundamental problem with our society and with democracy. And so we've got to get that outcome focus, and we've got to get that accountability. I suppose this is the simpler slide, which broadly speaking says the same thing. So if you prefer fewer words, that's the same general idea. So I've talked about adaptability. I will do so again in a moment. But let's just also look at the other aspects. This, in different places and different structures, impact bonds are brought in for slightly different things. It's that focusing in on rigor and evidence, which again is very important in a lot of different environments. The whole process of misaligned incentives. Very often, when we enter into a project, in fact, when we enter into a project, we are not looking for an impact bond, just to be clear. We're looking for how do you align everybody in that project around the outcome and objectives that you're seeking? How do you measure it in order to be successful? And what is the least complicated, lowest cost way of aligning all those incentives? The social impact bond is not the least cost, least complicated way of aligning those incentives. Sometimes it's the only way. But if you can find other ways of aligning, that's marvelous. Use the simplest possible method for doing so. But that misalignment and the loss of alignment is quite often where projects go wrong. The whole investing to save and prevention is better than cure is very strongly part of the agenda in the developed world. It's not so much part of the agenda typically here, although you can see value in terms of public health, for example, immunization. Those would cover some of the same sorts of arguments. But you don't typically have a model here which says, if you put the money in now, you save all this money down the road. You can do. There's arguments for it, but it's not the fundamental starting point in the way that it often is in the developed economies. And actually is to a detriment, because it sets a higher standard for whether to do a social impact bond than it does for a normal program. So it's a second order problem, and anyone who's focused on that as well can happily talk to me about it later. I said I was going on about this flexibility. I'll just do so one more time. This slightly cheeky ending, my view, when having gone through quite a lot of procurement in the last 10 years, is that the traditional model of procurement essentially designs out entrepreneurship. And that's quite awkward. And if we're honest, what am I spending my time thinking about at the moment? It's probably this interface between the public and the non-public sectors, and how do we try to improve that interaction? Because if you like, in the public side of that conversation, in the procurement team, if you're an economist, contestability breeds efficiency. You've got, on that particular point, maximum contestability on the private side, where they're competing fiercely to be as good at it as possible. And you don't have that same situation on the public side. And therefore, it tends to be cautious and risk-averse and focused on whether they could get sued for it, rather than on whether they got the best result. And I think that's I don't think that's a crime. That's just a cultural fact about procurement that I think we need to get more and more aware of as we think about trying to make effective services. That adaptation, I'll just put it into numbers. I don't have lots of different places where I've got reasonable scale numbers, but I'll just give this example of the gap between cohort 1 in the Peterborough and cohort 2. And what you're seeing is a real, essentially a doubling of efficacy of the service in terms of touch points achieved and engagement after 1 month, which is the kind of thing that you'd expect to see when you see constant adaptation in the program. And certainly, when the government was interested in taking the program on at the end of the service, it was quite complicated. They were transforming the whole of probation in the UK in a way that was slightly awkward. But that was, part of the conversation, if you like, was can they take it on? And the answer was, the essential first thing they said to us was we could never have procured this because it's become quite complex. It's become, it's basically tried to figure out where the gaps are, where the things are that are going wrong, and filled them, rather than this is the service that we do. Mental health for ex-offenders, for example, was a great example. Mental health services, yes, please arrive clean and sober at 4:30 on a Friday. Okay, that's a highly accessible service. Okay. We're going to put someone in your office every Wednesday, and they can just come when they like. They came on a Tuesday, they came on a Saturday. They kind of got the idea that 1 in 7 they get it right. So then the guy said, all right, I give up. I'm moving in downstairs. And that's when they started accessing mental health services, which for many of them were absolutely, absolutely essential. I think before I go into this is pretty complicated stuff and there are some difficulties, I just wanted to be clear, this is really filling some kind of need. Because since we started this, we signed Peterborough March 2010, it started going September 2010. It's not that long, and there's now 107 happening around the world. Yes, there's now over 100 folks. That is going to be a press release saying there's over 100 social impact bonds. Woohoo! You heard it here first. Raised quite a lot of money and touched quite a few lives. It's happening in a lot of places, and it seems to drive a need. And I say that because I'm now about to say where I think they're awkward, okay? Because, let's be clear, oh yes, I missed out my silver bullet slide. They're not a silver bullet. We know this, elegantly put by the State Secretary, that, again, this whole piece, this is great when there is a clear outcome that you can measure, or there is a way to getting towards a clear outcome. So even in education, where, the outcome, you clearly want people to get educated. You can probably drive a clear enough outcome in education. But there are a lot of areas, as you say, like poverty alleviation, where you're wanting to change what you're measuring the entire time, where you're wanting to really still figure out the measurement. If you're still figuring out the measurement, then an impact bond is quite an awkward thing to put in place. I would just add that I hope the culture of putting in place a learning engine, of looking at data and adapting, is, to my mind, the essential shift, and it's even more important in those complex environments. So I hope there's learning that can be drawn from the impact bond movement into those environments, but they do need something different from this kind of work. I think the other thing that we've met is when people want to use them in the bridge building scenario, where you don't actually need the adaptation, where the value is clear, and therefore you don't actually need either the risk transfer or the potential for learning. Then you just go do it. You can, generally speaking, build roads without impact bonds, for example. So I just wanted to be very clear on those specifics. Now, when my wife and I had children, I'm sure a number of others in the room had the same experience. You join a little group of other people who've just had new babies, okay? And you all talk about your new experiences, and it's all marvelous, okay? Now, I did, I'm afraid, a series of sociological experiments on that group. I have made that, I realize, filmed, so it could get awkward. But anyway, the sociological experiment was this. If the first story of the meeting was how little Johnny was marvelous and had just started walking and he'd said his first 3 words and wasn't it amazing, then the next story would have to follow suit. about how marvellous little Johnny was, and we'd go round, or little Tamsin, or little Amy, or whatever, and we'd go around the group and all say how marvellous our children was. And everyone would leave utterly depressed that everybody else was able to do this parenting thing while we were feeling absolutely terrible. Okay? But if the first story was how they had this utter disaster in the supermarket and it was completely humiliating, then the next story that came out was even worse. And everyone had a brilliant time and left feeling at least it's not just me, and thank that everybody is as incompetent as I am. So I felt it was really important not to start this conference off in the wrong direction. Okay? So if I started off all about the greatness, then everybody else would just be all about the greatness and we'd be in deep trouble. And we'd all go away thinking this hasn't resolved any of the issues. Okay? So I felt I had to demonstrate a modest degree of leadership and think through where are the things that are going wrong. So here are some of the things that we've learnt. The first element is risk transfer. And this one's a classic bit where those colleagues of mine who were in government said, Toby, your understanding of risk just demonstrates you've never, ever, ever been in government. And I said, OK, sorry, you're right. The piece here for them was, yes, this whole idea of risk transfer, of transferring financial risk, it's absolutely, absolutely valid. But if you're the person who is on the government side of that conversation, or the aid agency side of that conversation, let's just have a little look at it. Suppose the project does not generate the outcomes, you don't give them the money. Well, you've now transparently demonstrated that it's really hard to do work in your area, and it's failed, and you haven't given your money out, which means someone might want to claw back the budget. That sounds like an unmitigated disaster on a personal level. Now let's look at the other end of the spectrum. It's fantastically successful. It's generated outcomes beyond your wildest dreams. Investors have made 35% IRR. Hash awkward. Now you have the problem that you were a complete dolt when it came to negotiation. You had absolutely no idea, and you just wasted a whole bunch of public money paying investors. Oh dear. So what you need is a social impact bond that lands perfectly on that narrow strip somewhere in between. Okay? 7% return, it's probably about, oh, yeah, it's probably okay. 3%, it looks like you got a good deal, because they obviously took quite a lot of risk. 12%, that's a bit edgy, might just be okay. So you're landing on a very narrow strip. Now, you've got to figure out what the pricing is and what the outcomes look like. Do we have the benchmarking data? Do we know? Okay, so now I'm going into a darkened room. I'm trying to find some black cats. And what's more, if I find one black cat, then I'm in trouble. If I find 5 black cats, I'm in trouble. But if I find 3, it's okay. That strikes me as being, a difficult set of decisions for a number of people. So I just want us to reflect on the fact that as we build these models and as we think about it carefully, the people inside the aid agencies and bureaucracies working with this as champions of impact bonds are doing an amazing job. Because they're doing it because they know it's right. As we were happily told by a colleague who probably would prefer to stay nameless on this, he said while building the impact bond that we're working on with them, he said, oh, this is totally against all sensible things for my career. But it's just too important, so we're going to do it anyway. And I admire that hugely. But I do think as we build this out and as we think about it, that when you're building outcome models in a world which is still input accountable, then you're asking people to take on some fairly complicated things. That's just food for thought and reflection. Do I have an answer to that one? No? If you've got an answer, I would love to know about it. The second one is sustainability. We have found these have driven service adaptation. They have changed delivery culture. They have generated reasonable returns, but so far, none have been renewed in the same fashion. Most have been experimental, innovative programs, thank you very much, and good night. And where they have been sustained, they've been put onto a completely different footing. I mean, I have to say that the Transforming Rehabilitation Programme in the UK, which was often credited as being, partly because of Peterborough, isn't how we would have envisaged it or done it. I'll leave it there, so I'm being public. So we do have quite an interesting problem there, which I think, again, as we think about these models, it's important. And it's because we're trying to drive this much wider culture change, and each of these projects manages to create this space to be different. But then I think the world around it does not stay stable enough for it to carry on like that afterwards. And that's what's happening. And then finally, everyone said the costs would go down as the scale went up, and we'd find lots of lovely large social impact bonds. Woohoo! That's proved trickier, because generally speaking, the projects have been at the size or scale of the entity that one's working with. Local government in the UK is not going to provide you with a £20 million social impact bond. It just ain't. Because normally, the size of the specific blocks that you can make accountable for very specific outcomes are much more modest than that. One's doing culture change, big culture change, in order to achieve them, and that's a lot of the cost. And actually, when you compare the cost of doing that culture change for a social impact bond versus other culture change type work, it's really good. So they're good value if compared against wider culture change programs. They're bad value if you think of it as transaction costs. And we all generally think of it as transaction costs. So those are just my these are the things that are sitting there as tricky nuggets. What can we do about them? Is there anything we can do about them? What do I think the future holds? Obviously, I've been thinking more about the future than the present, because that's the kind of thing I like to do. And whilst there's a lot of discussion about improving the impact bond model and creating it for different spaces and markets, and a lot of that is useful, and we'll hear more about that later on today. I think my personal view and the wider view in social finance is that we need to be moving up towards thinking about markets rather than about individual transactions. And that means that you actually create an outcome framework for a market. So you're working with all the participants in that market around a common understanding of the data and a common understanding of the value of different outcomes. And you expect those outcomes to be changed in terms of valuation over time. So essentially, you make it relatively easy for providers to join the market, so procurement is no longer the primary barrier. You then create a payment structure which essentially defines your definition of success for that market. And if people are successful, then they will generate positive returns as organizations. And if they're not successful, then they won't. And then they will need help exiting the market again because they're not able to be successful. So you'll have every year more people joining, you'll have some leaving, you'll change and adapt the financial payment mechanism, the outcome measures, over time as you learn that certain parts of your population are being well served, certain parts of your population not being well served. All of this relies on two things, which are not generally in normal procurement. One is that you require the same data and data structures and data transparency across that marketplace. And that's totally possible these days. It's kind of absurd that we don't do it at the moment. And the second is it requires trust that once you've entered the market, the public sector side is not just going to push the price down to the point where it's no longer economic to join in. And there's a range of different ways that you can look at that trust. And I personally think that having some objective sustainability measure, so in other words, the revenue in this market will stay 3% above the costs in the market in aggregate. So if you're losing money in it, it means you're not doing a good job. If you're making money, it means you are doing a good job. But you've got that consistent message. Then you've got that kind of target, a little bit like an independent target for inflation rates or something similar. Then you've actually got a market that feels sustainable on all sides. So it's that's quite a radical, quite a different way of looking at it, but it would enable a long-term sustainable market where the providers were staying in it on the basis of the quality of the services they provided and not on their ability to enter into a procurement process every 3 or 4 or 5 years and generate a different result every time. I'll just do a few pictures of that. I'm probably near to out of time. I'm sorry if I look at my clock. It's only, oh yes, 29 and 20 seconds. Sorry, folks. Right. So the place that we're closest to building this is in Liberia at the moment, with a program called the Partnership Schools for Liberia program. There are 7 operators working in it, providing 194 management for 194 public schools. So it's an environment where you have 14 years of civil war and Ebola before. You have really, really poor educational outcomes. And the route to improving those educational outcomes by any normal policy means would take another 6, 7, 8 years. And so you really have a choice at that point if you're education minister. Do we wait and essentially have 20 years of uneducated children? Or do we put something in place which works on a per school basis and brings the capacity to do that from outside the country? And that's what they've done. And it's obviously a little bit controversial because private anything or non-governmental anything in education causes some people to have some kind of fits in the corner, so it gets a bit awkward. But it's, I think it's a very specific example of generating a lot of value. Now, the question then becomes, as people want to scale, how does one operate that marketplace? How does one make sure that it's transparent, that people are still continuing to generate quality, that everyone is playing on a level playing field and acting fairly? And so we are at the moment exploring this idea of creating an outcomes fund or an outcomes marketplace for this public-private partnership in Liberia. And as you can see, you'd allow people for a year or 2 to be on a grant to see whether they could generate outcomes in the Liberian context. And if they can, and they want to go to scale, then they need to move to an outcome-based contract. And therefore, you're keeping this focus on quality, but you have a fair model and marketplace for everybody to be participating in the same way. So that's the kind of idea that I see as having future value. I also think, by the way, that this kind of model, what we're looking at, is the potential for making it regional or making it work across other fragile states, because there's so much learning going on in one place. You've then got saying, where actually are there concentrations of very poor educational outcomes, a real need to accelerate that for wider economic and other reasons, and therefore the potential for bringing in this kind of model. So I just leave that just as an example of an outcomes fund as a way of doing things. And there are others that I know, I'm hoping other people are thinking about in the room, and I'm really looking forward to that part of the conversation today. And this is the only bit of naughty sales I will do, and that is that if you want to know lots about social impact bonds, our book from last year is still, I think, the largest sort of analysis of what happened in the first 6 years. And with that, I'm really looking forward to the rest of the day. Thank you very much.
Very interesting.
Thank you. Thank you very much.
Toby, thank you so much. As clearly someone who's thought a lot about this, and you probably have a lot of questions for Toby, but unfortunately we don't have time to take them now, so you'll have to buttonhole him during the day.